So my name's Bridget Kelly. I'm with the Early Start Research Institute, and my research focus is looking at the food environment and the impact that that has on the foods that we eat and our health outcomes. So I've worked in a clinical setting where I've seen the manifestation of overweight and obesity and the suffering that individuals face and families face from chronic diseases that are diet related, such as cardiovascular disease, type 2 diabetes and some types of cancer. And so I really wanted to move more into population health and preventative health to really try to overcome the burden of those issues before they start to manifest. So working in terms of children's nutrition and looking at the way that we can better shape our environment and our societies to support people to adopt healthy behaviours. So children are particularly vulnerable to food marketing because we know that their relatively immature cognitive development and lack of experience mean that they can't appropriately interpret the persuasive intent of marketing. So the framework that we've developed is really a new way to think about the way that food marketing exposures ultimately end up in influencing children's overweight and obesity in the long term. So there has been a real lack of policy action, and one barrier, a major barrier to that policy being implemented is a lack of cause and effect evidence, so to show that exposure leads to overweight and obesity. So this framework is really establishing a systematic way to think about that exposure and the outcomes that result from that, so that we can guide the development of policy and help to inform our advocacy efforts around the need for that policy.